Welcome back. Let's take you now back to one of our top stories where a group of unemployed doctors in KwaZulu-Natal is appealing to health officials to urgently place them. The doctors are marching to the offices of the provincial health department in Pietermaritzburg today. Last week, the health minister, Dr. Joe Phaahla, cited budgetary constraints as a reason for the budget placement challenges. Let's now take you live there to the march where Deputy Minister of Health, Dr. Sibongiseni Dhlomo, is currently speaking with the SABC. Dhlomo, thank you so much for your time. Just talk to us about, of course, the health workers who are unemployed have handed over a memorandum to the Department of Health. Just talk to us about what officials are saying now. Of course, a loud crowd there behind Nonhlakanipho Magwaza. Nonhlakanipho, if you can hear me, of course, we understand the marchers have handed over a memorandum of understanding to the health ministry. Just talk to us about what the department is saying.
Yes, Naledi, they have just handed in their memorandum, and the head of department of the provincial Department of Health, Dr. Shabalala, received the memorandum. They said that they will go through the memorandum and they will come back to them, and however, they will work together. The provincial department will work together with the committee that was formed by the unemployed doctors here in the province, just to find solutions and a way forward on the problem that they are facing now. We've spoken to a couple of them that they said that it's been 11 months that they finished their community service. Some finished their community service last month, and they've been applying for jobs, but they're not receiving anything. And some are saying that they want to specialize, but however, they can't go into private hospitals, because if they go to private hospitals, they will be unable to specialize. They have to start at the public health institutions. But with me now is the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, who will tell us more about when they received the memorandum and their promises. They said that they will look into the memorandum. Dr. Dhlomo, you did speak and address the unemployed doctors, and you said that there are things that you are working on that were in the memorandum. If you can just take us through on the things that were in the memorandum that you as the Department of Health are looking into.
No, thank you very much, and thanks for this opportunity. The memorandum that they've submitted to us is quite detailed. It will need all of us collectively as provinces and national to really look into that. But two positive out of it is to say, one, we would want to make sure that the budget of health is protected against cuts, because we are in this situation because, when there's a top slicing of government budgets, departments, we also get to be top sliced. Number two, they are saying so that going forward, we should not be fighting about how many, which data. We must synchronize the data of unemployed doctors very early so that the department, the unions of doctors and everybody else will come to that state. But as I'm addressing, let me just say, 10 years ago in this country, there was about 1,200 doctors who were completing in various medical schools. As health activists, some of us, we wanted to expand that into a bigger picture than what it is. Some of the students were sending bigger numbers to Cuba. Universities responded by expanding their intakes. Right now we have about over 2,400 students that finish at medical schools. We are happy to actually inform you that at least all those who have finished and are doing internship are placed. And all those who have finished internship on community services are all placed. Where we have had a challenge is placing all those post-community services, which is what now has brought us to be here today. I was actually reporting that over the past few days, the Minister of Health, Dr. Phaahla, has been engaging with the Minister of Finance. And on the SONA debate tomorrow, I am very confident that what the minister was sharing with me, and in fact, says he's going to make it point number one in response to the unemployment unemployed doctors, and it is positive according to my discussion with the minister.
Doctor, earlier on we did speak to one of the unemployed doctors who said that they were funded by the department, and the department spent 1 million just for one person to take them through medical school. But now, after the community service, they are unable to go back and work and give back to the community. What is your comments as the Department of Health about that situation?
We are happy we invested in many young South Africans to become doctors through what one doctor has indicated, placing them, because the training of a doctor is almost $1 million, as we are putting it. And some doctors are beginning to receive letters from some of the government departments to say, thank you very much, you had a commitment to us over 6 years, but we are releasing you now because we don't have money. We want to actually stop that process and really employ a lot of them. In fact, it did come as a shock to some of the doctors, because there was this expectation, if the government has funded me so many years, I need to pay back by working so many years. So to just can understand that I'm not able to give my service has not been a good story to tell. Hence, we are really working hard to reverse that, because some of these doctors are saying, I'm prepared to go anywhere, and a lot of them, they want to go even to the most rural. Because when we were expanding, we wanted to say even the rural hospitals must have, even the rural clinics at least must have one visiting doctor. That is something that we really are together with them in terms of pushing forward.
Thank you so much, Doctor.
Thank you very much.
That was Deputy Minister Dr. Sibongiseni Dhlomo giving us a background into saying that basically that they are with the doctors, the unemployed doctors, in that they will be going into to Parliament and requesting that the Department of Health be exempted from budget cuts, as the unemployed doctors were mentioning in their memorandum. And it did say that the memorandum is a detailed memorandum. It will take time for them to go through what was written in the memorandum, but however, they will be speaking or liaising with the community, the committee that was formed by unemployed doctors in finding solutions to their plight. Back to you in studio.
All right, that was Nondla Kanipo Magwaza there in conversation with the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Of course, this follows the protest by unemployed doctors in KwaZulu-Natal.